The honourable member for Fraser.
Thank you, Deputy Speaker. On the 14th of December last year, I had the honour of assisting Pat Douglas to sign up as the first patient in the ACT in southern New South Wales in Calvary eHealth. It was a delight to meet Pat Douglas. She's 82, still living independently, a bright person and a wonderful contributor to the North Canberra community. Mrs Douglas had a fall in a street near her home and acquired a brain injury. And her experiences with the care and her health records demonstrate why eHealth is such an important development. Mrs Douglas was confined to hospital for 10 weeks. After undergoing rehabilitation, she returned home, but none of her regular doctors knew she had been in hospital. None of the doctors knew about her injury or how she'd been progressing. And similarly, the hospital was unaware of Mrs Douglas's regular health requirements. Any information on normal medicines or routine checkups that Mrs Douglas might have required during her time in hospital wasn't available to the doctors at Calvary. Mrs Douglas told me she thought it was a bit ridiculous that none of her doctors could share information about her previous conditions or about her current conditions. It all seemed to her to be unnecessarily complex, and I couldn't but agree. Mrs Douglas wanted all of her doctors who look after different aspects of her health to be fully informed, and they can be fully informed by being connected to one another through the eHealth records. I'm delighted to host in my electorate of Fraser one of the 12 national projects pre-testing elements of the personally controlled electronic health record system. I was personally so impressed with the setup that I became the third person to sign up for Calvary eHealth, just after Mrs Douglas and Calvary CEO Ray Dennis, who also took the opportunity to sign up at the launch in December. Deputy Speaker, I'm a great fan of technology. For the time it was in existence, I signed up for the Google Health electronic health systems. In principle, that was a great idea, but as Google learned, you need a consistent system and one which is common across patients and doctors. Deputy Speaker, I'm excited by eHealth, and I'm also, in general, excited by the possibilities of technology for our healthcare system. The National Broadband Network will improve access to medical specialists, particularly in rural and regional Australia. That'll mean people get better quicker, and it'll mean that rural and remote communities have access to better medical care than they did before the NBN. That's a productivity benefit. That's people getting healthier and getting back to work or back to whatever they were doing before they fell ill. eHealth records are a great example of how technology can improve healthcare. It's an easy way for people to be on top of all their health requirements, and an easy way for patients to enable their doctors and allied health professionals to share information. Your GP will be able to know what your dietitian has recommended. Your chiropractor and physiotherapist will understand the different types of treatment you're undertaking. You won't need to explain your allergies, your medicines, your immunisations every time you see a different doctor. Deputy Speaker, eHealth records won't contain every single detail, but rather they'll contain the information people need to be shared between their health providers. A Calvary eHealth record contains the following: a shared health summary, including basic information such as name, date of birth, address, contact details, as well as allergies, immunisations and the medicines that the patient's currently taking. Contains a summary of each consultation, medical conditions, referrals, specialist letters, discharge summaries following hospital admissions, and diagnostic reports, such as X-ray results. It also includes shared care plans agreed between GPs and participating healthcare professionals. Deputy Speaker, looking after the well-being of Australians through a terrific health system is what the Labor Party does. This is, after all, the party that created Medicare. Deputy Speaker, because the government cares for the issues that matters to most Australian families, we are implementing eHealth. That means that when a member of a family becomes ill, they can get the help they need from their local hospital, irrespective of their circumstances and their location. It's not going to matter anymore if you're out travelling when you fall ill, the e-health record will be there with you. And we're continuing to make healthcare more accessible and more affordable, ensuring the modern healthcare system upholds those great Labor traditions of equity, fairness, dignity. The Labor Party is the party of reform, and this is true as much as anywhere in the area of healthcare. E-health records are particularly important for a number of disadvantaged groups. They're important for young adults who've moved away from home and are finding a new GP. They're important for older Australians because we tend to have more complex health needs the older we get. And they're important for people with lower levels of literacy who might have more difficulty relaying information provided by one health provider to another. Deputy Speaker, my electorate is younger than the average Australian electorate. The average age in my electorate is just 33. That's because, in large part, many young people have moved to Canberra to take advantage of the excellent education and career opportunities this city has to offer. But that also means that many of those young people have moved away from their normal health provider. E-health records will help them to have their previous GP share the information with their new GP. For older Australians, as Mrs Pat Douglas so well illustrates, they might be seeing a gerontologist as well as a GP and a chiropractor or other allied health professional. They might have a fall and end up in hospital. E-health records will help older Australians better manage the flow of information between their existing health providers to ensure nothing gets missed. It'll also mean that health professionals are aware exactly what medications people are taking. And it'll mean that there's no mistake in prescriptions where a patient is mistakenly prescribed medications that can't be taken together. For Australians who struggle with literacy, there'll be less of a need to fill in complex and confusing forms every time they see a new health professional. Instead, they'll be able to let their health professionals see the information in their health record and share their medical history without needing to recall complex details. In fact, e-health records will be a benefit right across the Australian community. I have two young and energetic boys, but they always seem to be either catching lurgies or falling off things, so I've spent far too much time over recent years sitting in hospital emergency departments or paediatric wards. If it happens interstate, it's enormously frustrating to have to retell a child's medical history, to have to fill out the same forms again and again, to have to go back through the same family history that you've gone through with another doctor. Deputy Speaker, economists know that sometimes it's the simplest reforms that are most effective. I've spoken before in this place about the reforms to encourage doctors to wash their hands and the many lives that saved in public hospitals. And similarly, the simple answer of sharing information between medical practitioners will lead to better health care. Deputy Speaker, I'm told that 190,000 hospital admissions each year are due to medication errors. Better sharing of information about current medicines will reduce these sorts of unnecessary admissions. It'll free up doctors and emergency rooms for other life-threatening occurrences. Better information sharing can also lead to reduced time and cost spent addressing other avoidable medical errors or avoidable degradation of chronic conditions. As demonstrated by the example of Mrs Pat Douglas, we saw that Calvary Hospital was unaware that Mrs Douglas was taking additional medications and needed to see a specialist during that time. If Mrs Douglas had had an e-health record, all that information would have been available to her doctors. Deputy Speaker, economists hate waste and duplication. If we're sharing more information, we're reducing the amount of time and money spent on unnecessary and duplicated procedures, such as diagnostic testing. Put simply, patients will spend less time explaining, more time getting the help they need from their health professionals. E-health records are also a great development for patients as consumers. It's an opt-in system. Repeat that for the member for Patterson. It's an opt-in system. And that means no one will be forced to have an e-health record. Opt-in's important for privacy. It's important for making sure patients understand what they're signing up for. By making health records personally controlled, managed by the patients, we're giving power to consumers. Consumers are the ones who will be able to take better management of their own health and be able to decide whether they show their information to family members and friends and what they do to reduce avoidable adverse events. We're getting patients to make better informed decisions about their health care and their access to health records. Patients can also give family members permission to access and share their health as necessary. Going back to Mrs. Douglas, she might have allowed her children to share her information in the event of an adverse health occurrence, such as a fall. Deputy Speaker, this is a great development, but it's a reform that only the Labor Party is brave enough to commit to. We in the Labor Party are the party of reform, and we're the party of health reform. And we're the party of equity, making sure that the most disadvantaged in our community are able to access all of the developments technology has to offer. That's true in rolling out the national broadband network to all Australians, and it's true with providing all Australians the opportunity to have an electronic health record. This reform, Deputy Speaker, is proudly in the Labor tradition. Deputy Speaker, I'd like to take the opportunity here to also make a point on a related issue on health. On the ABC TV's Q&A program last week, the member for North Sydney mentioned employees of the Department of Health and Ageing as an example of some of the 12,000 public servants who he would like to make redundant if Tony Abbott were to become Prime Minister. And the concept of e-health records, the legislation we're debating now, wouldn't be possible without the hard work of public servants from the Department of Health and Ageing, using their knowledge and their expertise to come up with a system that's appropriate for the Australian context. Making sure the right privacy concerns are in place is the responsibility of those public servants. Monitoring the testing sites and seeing where we can make improvements is the responsibility of those public servants. Those opposite have said they're going to support this legislation, but apparently they think you can have e-health without a Department of Health. It doesn't make much sense to me, Deputy Speaker. Deputy Speaker, the member for North Sydney thinks that just because there might be no patients taken care of by the Department of Health directly, that people in the Department of Health aren't performing important work. But it's only through their expertise, their willingness to drive reform, who are able to get health reforms that will save money, save time and produce better health care. Important health reforms and agreements between the Commonwealth, the states and territories are only possible thanks to the highly experienced public servants to administer these programs and this funding. Many of the public servants performing this work live in my great electorate of Fraser, and I know how hard they work and how devastating it would be for the broader Canberra economy if the Coalition were to come to office and make 12,000 Canberra public servants redundant. We saw in 1996-97 what happened when the then Howard government came to office, when the public service was slashed and burned to a much greater extent than had been anticipated by John Howard as the Leader of the Opposition. So, Deputy Speaker, I commend the legislation to the House. E-health is an important reform for Australia's future, and maintaining a strong public service will ensure that e-health becomes a reality.